Good day, everybody. On behalf of Palliative Care Team, I am Dr. Lani Pofwe, one of the members of Palliative Care Team assigned in the administrative area. And I would like to welcome all of you here to our first Palliative Care lecture. To start, I would like to introduce first my teammates who will discuss a very important topic on palliative care, which is the empathy and compassion. The first part of the lecture will be given to us by Dr. Adelina Uybico. She is the full-time consultant of palliative care assigned in the Patient Service Division, while the second part of the lecture will be given by Dr. Shohara Hentica. She's also a full-time consultant in palliative care assigned in the research. Then after their lecture, we will be entertaining your questions and the closing remarks will be given by our palliative care specialist and the head of the palliative care committee, Dr. Rhea Haima. Now we will be giving the time to Dr. Uibico.
Okay. Good day, dear doctors and residents. So it's one of our aim as a team is to encourage a compassionate healthcare service. And we would want to share first the heart of the palliative care, and that is the higher and highest form of care, which is empathy and compassion. So the objective of our lecture is to define and differentiate the two terms, empathy and compassion, and to provide practical examples for each care construct. So the next slide. So we all know that work can be hectic, long, and chaotic. And sometimes we tend to forget about the most important things. Our patients and their parents come to our hospital not just for cure alone, but also look for care and comfort. That's why we are not only called as simply as health workers, but health care workers. I would like to emphasize that word care in between those words. So there are three care constructs. So you have your sympathy, empathy, and compassion. Sympathy, you have sympathy for which it is the most basal among the three forms of care. It is a pity-based response to a distressing situation. We'll focus more on the higher and highest form of care, which is empathy and compassion. By dictionary definition, this is empathy is the understanding or being aware of, being sensitive to, and vicariously experiencing the feelings, thoughts, and experience of another. While compassion is the sympathetic consciousness of others' distress together with the desire to alleviate it. So to further differentiate the two terms, we have a definition for in terms of palliative care. So empathy is the affective response that acknowledges and attempts to understand an individual's suffering through emotional resonance, while compassion is the extending feeling with to feeling for, while also adding the doing for. It ranges from routine care or a mere sense of duty to acts that went beyond the call of duty. These three care constructs, sympathy, empathy, and compassion, are often used interchangeably within the healthcare literatures, despite some key notable differences. But for us, the most important of these three care constructs is empathy and compassion. So hence, empathy and compassion is translated on how you interact with our clients. So interactions have impacts, and the interactions can come across as compassionate, kind, and caring. Or it can also come across as mistrust, confusion, and anger, which we don't want to have in our hospital. So to help us learn about the best way to interact and create a positive impact on our clients, the patients and their family, I give you Dr. Shohara Hentica.
Thank you, Dr. Orivico, for that very clear introduction. So for now, we will talk about the vital part of giving compassionate care to our patients, which is good communication. Please take a look of this slide, which basically tells us that our knowledge and intellect are useless if we cannot convey it properly. So to define the good communication, it means it is an essential component of palliative care. Actually, not just palliative care, but in life in general. And it is mostly complained by patients and families when there is lack of good communication. And it impacts the quality of care, patients and families' well-being, and coping of family in bereavement. So I have a question for you. When you are silent, is that good communication? Yes or no? The answer is yes and no. Yes, because sometimes silence is a better option, and no, because it may lead to misunderstandings. So, for the sake of this discussion, let us at least take this in mind, the aims of communication, and make it our goal whenever when we talk to somebody, when speaking up and sharing our thoughts, but in truth and love. So, the aims of communication is sharing information. Another is reducing uncertainty. During periods of uncertainty, the patients want to hear about non abandonment, acceptance, and affirmation. And another aim of communication is to facilitate choice and joint decision making. And lastly, to create, develop, and maintain relationships. Okay? So, to give you examples of empathy, basically empathy is how would you feel if you are in someone else's shoes. So you express words that somehow tells your patients that you feel for them. So one of the few examples are like, thank you for staying positive, I feel for you, I am on your side. Okay. And for the examples of compassion, next slide please, is eliciting the patient's feelings and concerns by greeting and asking, how are you? What can I do for you? So to give you a usual scenario in the ER, we usually ask our patients upon facing them on first consult, we ask them, Mami, bakit po kayo napasugod ngayon sa ER? Uh, Sometimes uh, we mean to say ano yung concern nila, right? But remember that in psychology, when we ask why or bakit, sometimes it always, I mean, most of the time, it says or for it gives a idea of being judgmental. Bakit? Bakit kayo napapunta or napasugod ngayon sa ER, mommy? And sometimes patients take it offensively. So might as well instead of asking bakit, we can ask them, mommy, what can I do for you? What is your concern? Ano po ang may paglilingkod ko sa inyo? So things like that. Another is being an active listener when patients discuss their health issues. We can express active listening by nodding our head, saying that we understand what they are saying, or we can also repeat what they have said so that they will know that we are understanding or we are analyzing what they are saying. Another example of compassion is knocking on the door before entering. At least having that etiquette of knocking first, or thinking, being mindful of the other person on the door in the next room. Okay. Another is taking time to explain tests and procedures. Sometimes compassion is spelled as time. When we take time to explain to them, they feel that um, they are important. You spare time for them to explain or entertain questions from them. And lastly, solidifying your bond with your patients. Sometimes it would mean you doing the extra mile. Even if it's beyond your duty, you can still show compassion to your patients by doing something that they would not expect you to do. Okay? So, for the take home message, basically empathy is different from compassion. And compassion refers to both the feeling and the action. that stems from that feeling. And compassion is the heart of palliative care and also the highest form of the three care constructs. And most importantly, patients can tell the difference and they would prefer compassion. Okay, the last slide would just tell us or differentiate clearly that empathy is identifying and understanding other person's feeling without motivation to help the person, while compassion is understanding and showing concern with associated action in helping that person. Okay, that would be all. And to give you more examples, we will show you a video of a compassionate care being done in a hospital setting.
I'm passionate about compassion in healthcare because I believe that compassion is the one thing that we could be focusing on to change the culture within the NHS. So what is compassion? Well, compassion is that feeling that we've all experienced when we know that there is somebody that really cares for us. Compassion comes from that moment when we can see the world through another person's eyes. In healthcare, I believe that it comes from people who love their work and who truly understand why they do what they do.
Compassion is about treating patients with dignity, respect, and empathy through your communication skills and through your actions.
It doesn't take very much. It can be a very small gesture that the nurse may do. I only this morning dealt with a lady that had come about 10 miles on the bus. She was elderly. She would have been entitled probably to have hospital transport. She made her own way here. When she came in, she was cold. So a cup of tea, 2 biscuits, and she was much, much happier. And that little thing really does make a difference.
I think it's particularly powerful when we are feeling vulnerable in physical or psychological pain, or when we are afraid.
My son is bedbound for 6 weeks, so boredom is a big factor. So if he was just left alone in this room, he will deteriorate, become sort of depressed almost. So the nurses come in, cheery faces. They ask quite often, do we need anything? Even the dietitian comes in and they'll try and encourage him to eat by sort of giving him star charts and goals to aim for. So they're trying to encourage him to get better.
The consistent theme is that it is always the smallest things that make the greatest differences.
You hear so many stories nowadays about people being treated as a number. And it's my experience, the professionals that are looking after me really do seem to care about what's happening, what they can do about it, and keeping me informed as to how they're doing it. And once you have that information, that empowers you then to obviously deal with your illness as best way you can.
Not only that, it's all the staff, even the canteen staff, how good they are as well.
Compassion isn't just about talking to the patients, it's making them feel safe in a nice, clean environment where they can feel at home.
They've really been so kind to me. Made me comfortable all the time. I might be a bit anxious over something, but they soon sort me out.
So I see compassionate care being delivered when the staff themselves feel cared for, when they feel free to speak openly, free from fear, then they work together as a team and they trust each other. I think that the most valuable gift that we can give each other and to our patients is the gift of time. Time to allow the patients to speak about what matters most to them. And most importantly, time for the staff to listen.
I think you have to show a genuine interest in the patient without being judgmental. Try and find out a little bit more about their lives, their beliefs, their values, in order to empower the patient to be able to make decisions about their rehab and the goals that we're going to set together.
They often divulge all sorts of different things about their worries at home. It might be who's going to walk my dog while my leg's in plaster. And it's things like that that we can help to facilitate arrangements that make a big difference to how they experience their care.
I believe that if we focus our attention on things that matter most to our patients, then we will gain their absolute trust. This trust would improve clinical outcomes, would improve financial outcomes, would empower patients to improve their quality of life, would reduce their dependency on their system and improve morale of our staff. This has to be our number one priority.
Thank you, Dr. Uibico and Dr. Hentika, for a very informative lecture on empathy and compassion. I know that all of us need this to apply in our practice, and this matters most because these things differentiates us from other practicing pediatrician. Now, the floor is open for your questions, queries, and clarifications. If you have some, you can raise your hand and we will call you.